in. So I definitely want to do one on the menstrual cycle, perimenopause, menopause, but also postpartum too. So if you have any ideas for any other lectures that you're hoping to learn some more information, I'd love to hear from you.
Definitely postpartum, because I'm just out of that phase right now, but still kind of wonky.
Yeah.
Stuff. So like we really need to see what works. I hope kind of get everything stabilized again. We just
patients feel like they don't have much support postpartum. So even just learning about your body and the hormonal fluctuations that you go through, just to have more info.
Hysterectomy.
Yeah, definitely. Especially not only if you're doing like a partial misting your uterus out, but if you're taking everything out. And that kind of pushes you into menopause really, and having the options of that. We're working on, because we recently are able to recommend bioidentical hormones. Previously, we needed a prescription for those if they were compounded or just the traditional patches. But there is something in the company that we use that offers bioidenticals. So that's opened a whole pathway for us now. So I'm working on a little bit of newsletter, some information to send to patients so that they know that people are. I think all the information that's coming out about hormone replacement therapy, it's really difficult to kind of figure out if it's best for you. Because there's not a lot of information out there, and a lot of the new stuff is telling us that it's safe when everything 20 years ago said that it caused cancer. So. Yes.
The sleep. Lack thereof.
Yeah, definitely. We're going to touch upon cortisol and melatonin today, which regulate our sleep cycle and our circadian rhythm, and how important that is. And I'm going to get on my soapbox about how cortisol isn't the bad guy. The problem is the society we live in that's causing us to spend a lot of cortisol, which is something that I stress about with my patients. We're going to talk about cholesterol. I have a handout in front of you with a basic hormonal pathway and how our body makes these hormones. And you'll see at the top is cholesterol. We're going to talk about how important cholesterol is because it's in between all of our sex hormones, and you'll see that cortisol is so cortisol, cholesterol are kind of the bad guys in medicine right now. And I want to stress the importance of thinking and having
Okay. So I'm just going to turn off the lights. It will get a little bit dark and it'll just help it.
So welcome. I'm Dr. D, short for Dr. Bethany. I go by Dr. D. It's just going to be easier for everybody, but I get the question a lot of how to pronounce my last name. You're Bethany, so I just go by Dr. D, but it is Bethany.
The mouse is behind you, Dr. D.
Okay. And then okay. So just some updates. So we talked about the bioidentical hormones, which if you're subscribed to our newsletter, which is probably how you found out about our lecture. I'm working on some support materials for patients just to talk about those bioidenticals and know that you do have an option. And it's something that you can talk about with your doctors. One of us. The other update is Esperotic treatments, which if you subscribe to our newsletter, you might have seen that. So Esperotic, it sounds like a medieval torture, which it's used for cervical HPV and dysplasia, so abnormal pap smears. And so basically it's a way to treat the cells on the cervix so that they can kill themselves and treat that HPV so that women don't have to do surgery and do those leak procedures or cryotherapy as well. And for those that have just chronically abnormal pap smears. I've done a video about that a couple months ago. There's some more information on our website as well. So I just trying to spread the word. So if you know anybody that's struggling with abnormal pap smears, HPV that won't go away despite treatment, or looking for other options, I would recommend them. We have a 10-minute free phone call, but I can answer questions. So questions that will be answered today: what are hormones? What hormones do in our body, and how we make those? How are they regulated? And just kind of like creating the basics to understanding hormones. Because when we say hormones, I think for the most part, most of my patients, because I do see females, mostly they're talking about sex hormones. But we make so many other hormones in our body as well. I told you I was a 90s kid, so I had to put SpongeBob on there. So, hormones. The definition of hormones, they're basically a chemical messenger. So think about them kind of like text messages. They help our body communicate with each other, and they tell our organs what to do. They circulate in our bloodstream, and they control the actions of our cells. So the whole stream of hormones, the organs or glands that make those is called the endocrine system. So when you have a hormonal issue, you go see an endocrinologist. So this is a nice little diagram just showing the different glands in the endocrine system that make our hormones. So these are a few of them: the hypothalamus, the brain, and the pituitary gland are the main ones there. Pineal glands here too, which makes melatonin, which we'll talk about. And then these send signals to our organs, whether that's the thyroid, the parathyroid, the adrenal glands, which we'll talk about, the ovaries, testicles, and the pancreas as well. So when we talk about hormones, I think in medicine, we try to kind of look at things linearly, which if you look at that graph in front of you, it's pretty linear. But the body's constantly creating this feedback loop of our hormones, and the brain's signaling to our organs, the organs are signaling to our brain, and it's kind of this big loop. And so whenever we test hormones or talk about them, it's super important to look at both everything above and below of where the issue is. So we talked about these glands: the hypothalamus, the anterior pituitary, posterior pituitary, and the pineal gland. So these are all in the brain. So this is kind of the command center of our hormones. And so the pituitary gland, which is right over here in the brain, sends signals to the rest of our body. Anterior just means in front, posterior means behind. So there's two different parts of that. And those two parts of the brain make different hormones. The adrenal glands. So we touched on a little bit about cortisol. So cortisol is made in the adrenal glands. And I think that is then a huge topic of medicine. Especially I get a lot of questions about this. And then some other glands, the pancreas too. One of the main things that you'll hear a lot about is insulin. So the GLP-1s, Ozempic, semaglutide, these work on some of the hormones that are in the digestive tract, and they can mess with insulin. We talked about why that. Testes, the ovaries, those make our sex hormones, and then the thyroid too, which is something that if you've been in our office before, we usually stress the importance of the thyroid, and after today, and then parathyroid glands, which usually aren't touched upon much, but they regulate our calcium levels. So there are a few different types of hormones, and this is important because these tell us the building blocks of each hormone and how they're broken down. So there's amines, which essentially are made from amino acids, which are the building block of proteins. There's peptides, which are a bunch of amino acids linked together, but they're shorter than proteins, which is a longer chain. And then there's the steroid hormones that are derived from cholesterol, which is why I usually stress to patients the importance of cholesterol and why it's not necessarily okay, so amine hormones, these are the hormones that are made by amino acids. So amino acids are building blocks of protein. So a lot of patients now I see are taking kind of branched chain amino acids or amino acid supplements. And the two in particular that are really important for hormones are tryptophan and tyrosine. Tryptophan, one of the fun facts that one of my professors used to talk about all the time when it comes to sleep is turkey. It's actually pretty heavy. So he used to say if a patient's having any issues to just eat a slice of belly turkey before bed, which I don't necessarily think that's gonna fix everybody's sleep issues. But it might help stabilize a little bit of the blood sugar at night, but that's why tryptophan is important for making melatonin. And then we have tyrosine, which is another amino acid. This makes other life stress hormones like epinephrine, which is adrenaline, and dopamine as well, which plays a huge role in our brain. And then we have our peptide and protein hormones. So these are amino acids that are linked together that form a chain. So they're a little bit bigger. An example of this is FSH, which is growth stimulating hormone. This is what that pituitary gland makes to pancreas or testicles make some of the sex hormones. And then this says I'm watching my cholesterol, watching it go up. And these are our steroid hormones. So these hormones are made from cholesterol. So that diagram in front of you will show you all of your steroid hormones. These are made from cholesterol, things like testosterone, estrogen, but also cortisol. So we're going to talk about the importance of cholesterol and cortisol and how that can affect health. The one thing too is, there's a lot of information out there about the best way to test for hormones. And the thing is that depending on what kind of hormone we have and what we're testing, sometimes we have to test it in different ways. For myself, I know that I usually test most hormones through the blood because it tends to be easier, but hormones fluctuate on a daily basis. And you can have hormones that are in your saliva, in your urine, and breakdown products of that as well. So with hormones, sometimes one place isn't the best, and that's because fats can go other places in the body. These proteins can be in other places as well. So back to our little diagram. So we're going to talk about the hypothalamus. So this is the part of the brain that's basically up at the top, the center of everything. The hypothalamus and the pituitary together is what we call the command center of our endocrine system. And this sends signals to our pituitary. So whenever we're talking about hormones, most of the time when we have those tested, we think about things like testosterone, estrogen, progesterone. But for most of us, if you're a patient at our office, you notice that we test a lot of things, which is why you give us so much blood. And I always say that I'm a vampire in the beginning because I do take a lot of blood from my patients. And that's because you can't just look at the hormones that are downstream, like the T3, T4, those thyroid hormones. You have to look at what the brain's doing too to see if that is causing any issues. The hypothalamus, these hormones we tend to not check just because the pituitary hormones tend to be easier to test for. The hypothalamus more often than not doesn't have an issue. I have yet to come across that, not only. If anything, it's usually the pituitary too. But we're going to talk about the hormones that the hypothalamus, which I'm going to throw out a lot of different things at you. We're going to talk about the most frequent hormones that most of my patients ask me about. But these ones essentially are made in the hypothalamus, and these are what tell the pituitary to make their hormones. So you see there's different types. There's the thyrotropin releasing hormone. This stimulates TSH, which is a thyroid stimulator. The corticotropin releasing hormone, that stimulates ACTH, which eventually tells the adrenal glands to make cortisol. And then we have our gonadotropin releasing hormone, which tells the pituitary to make LH and FSH, and our sex hormones. And there's a few other ones that are made here, somatostatin, which we really don't test, but that's more responsible for growth hormone, TSH, and then there's dopamine as well. And then the pituitary gets signals from the hypothalamus. So the pituitary has two different parts, the anterior and posterior. So anterior is more towards the front of the body, posterior towards the back. So this receives signals not just from the hypothalamus, but from organs as well. So all of our hormones are made in a feedback loop, essentially. and that can be a positive or a negative. So, for example, positive, say you're like me this morning and your dog, who is a bit of a menace on the leash, sees a drumstick on the ground. That's about this, and she won't let it go, and she wants to eat it, and she's 70 pounds. So for me, you're trying to get her off of that. So what my body does is realizes, okay, we have to get her away from that. So my body needs energy. So what it does is it starts creating this positive feedback loop. And my body goes into fight or flight, and it starts releasing hormones because it knows that I need to get her away from danger and solve the situation. That's an example of positive. One of the most common negative feedback loops that we see more often is with the thyroid. So you can have overactive or underactive thyroid. What will happen is if the thyroid is making too much hormone, the brain's going to pick up on that and realize, okay, you need to slow down. And so what the brain will do is it will start reducing its hormone so that the thyroid can kind of relax a little bit. And that's how we end up diagnosing patients with hypothyroidism or underactive thyroid, because we notice that TSH change. With the opposite, what will happen is if the thyroid is overproducing, I think I switched that up, sorry. If your thyroid is making too much hormone, your body will start to reduce that TSH. If your thyroid's not making enough, what will happen is the brain will start pumping out its hormones more. And I think of it kind of like a teacher trying to get the kid's attention. Like, hey, we need to start making this hormone. So it's never just about what the organs do, it's also what the brains do. And this becomes this huge feedback loop, which can get confusing sometimes too. But that's why it's super important not to just look at one hormone, but also see what the brain's doing as well, and that kind of stuff. And then, so the pituitary makes all of these hormones that are signaled by the hypothalamus. So growth hormone, which tends to be in higher quantities when we're younger, prolactin, which is responsible for milk production, and then that thyroid stimulating hormone, which if you're a patient of us, you usually will have that checked too. So that's important because if that's too high or too low, that will tell us that the brain's picking up on something. And then there's ACTH, which tells the adrenal glands to make cortisol, and then FSH and LH. So growth stimulating hormone and luteinizing hormone is responsible for our sex hormones. So these, with the menstrual cycle, regulate and fluctuate throughout the cycle. And then one of the things that I usually will do for patients if they're perimenopausal or menopausal, we'll test your FSH and LH to kind of see where they're at too. Usually what will happen is when you kind of get to the perimenopause stage in your life, if you're menstruating, what will happen is the ovaries start to send signals to the brain and they're like, okay, we're done. We're not doing this anymore. We're not making the same hormones we used to. So what will happen is the brain picks up on that and it will start to increase that FSH. And that can usually tell us. And it's why most doctors, because a lot of my patients tell me that their gynecologists won't test their hormones. And that's because we know usually what FSH and LH is going to be high. One of the things that I tell my patients that come to me during the perimenopause and menopause stages in my life and tell me about the weight gain that they notice in a short amount of time, especially around the abdomen. One of the things that causes that is that FSH or follicular stimulating hormone. So as it starts to increase, what happens is it increases the size of your fat cells in your abdomen. And that's where you make most of your estrogen after menopause. So there's a reason to it. None of us like it, but that's why the body does it. And what will happen is eventually when I talk more about the bioidenticals and hormone replacement therapy, what it does is once your body starts getting that estrogen and that progesterone, those hormones start to decrease because of that feedback. The body realizes, oh, we're getting estrogen again. We're getting progesterone again. So to kind of see if you're absorbing it and things are going well, that FSH and that. I know I'm going fast. Any questions so far? And then we have the posterior pituitary, which doesn't make as many hormones, but these ones are so important. So oxytocin, this is our hormone that's responsible for uterine contractions. So we usually see this higher than women that use it. But it's also the pedal hormone. So this will pop up to after sex as well. And then antidiuretic hormone, this actually will tell the body to start absorbing our water. So I see that more often sometimes with patients that have issues with blood pressure. Because if you're absorbing more water, it'll affect it. And then the pineal gland, this is what makes melatonin. So this regulates our sleep-wake cycle. So I get this question a lot from patients, should I take melatonin? And some of my patients will ask me, I thought it's supposed to be bad for me because it causes some issues with the brain. And this is kind of how we reason that, which is if you're taking a hormone like melatonin that the body naturally makes, the idea is that it could potentially shut off your body's own production. So that's how it is. So because of, think of any time you're taking a hormone, it's going to mess with that feedback. So I get that a lot from patients. I don't see enough studies to really say that it's a bad thing necessarily because melatonin does come with good benefits. But anytime you take a hormone, just know that it's going to mess with that. So here are the hormones that most of my patients use. You have this diagram in front of you. So I'm going to get on my soapbox for a second and talk about cholesterol and cortisol. So cholesterol, I think, and cortisol are kind of the bad guys in medicine right now. We want to lower cholesterol as much as possible, and we want to lower our cortisol levels. One of the things that, being an antibiotic doctor is we want to find the root cause and treat that and find out why your body's doing that. 80% of the cholesterol in your body is actually made by your liver. So most of it you're not getting from your diet. Cholesterol tends to be a response to something. A lot of my patients that I see with hormonal imbalances and things like that tend to have higher cholesterol levels. And sometimes that's in a response for something else. What you'll see here is that most of your hormones are made from progesterone. And so everything goes from progesterone, you'll see testosterone's over here, estrogen's all the way down here, but you'll also see cortisol's here as well. So cortisol is our stress hormone, we're going to talk about that. But what will happen is if you have high cortisol levels, a lot of that cholesterol, a lot of that progesterone will be shunted to that. And that's really what I see that's causing a lot of hormonal imbalances for my patients. So estrogen, essentially it's made primarily in women in ovaries, and men also make estrogen too, in their testes, and then also from testosterone in fat cells. So like I mentioned, with that FSH increasing the size of fat cells in the abdomen postmenopausally, that's because we make estrogen from fat. Some estrogen is made from our adrenal glands and some from the fat cells as well. Our adrenal glands essentially they just sit over our kidneys, so that's where they are. And most people talk about that as a source of our cortisol, which we'll talk about too. So in women, estrogen is really important for regulating the menstrual cycle. It supports pregnancy. What it does is it actually increases the thickness of the uterine lining, and that's what sloughs off every month and allows us to. But it's also really important for bone health, skin health, and also immune health, which is why hormone replacement therapy has been getting a lot of information and just a lot of push right now with all of the research, because we're now finding that potentially using some estrogen postmenopausally can be really helpful for preventing osteoporosis, osteopenia, but also maintaining immune health as well, reducing the risk of Alzheimer's. For men, it supports sperm development. and also bone health and libido. For men, it's usually a balance. A lot of men that I see now, especially younger men, have been having pretty low testosterone levels. I've been seeing a lot of that in my hypothesis for that, but essentially too much estrogen for men can cause issues as well. So it's kind of a balance. Whereas women, we have too much estrogen and not enough progesterone. That's going to cause a lot of heavier bleeding and clotting. That's what progesterone does in the body. So estrogen is regulated by those two hormones, FSH and LH. But the more body fat, the more estrogen, which is why your body does that. So progesterone, this one also made in our ovaries. So what happens is during the menstrual cycle, what happens is after the egg is ovulated, the cells that are in the ovary will create what's called the corpus luteum, and that is what will release progesterone during the second half or the luteal phase. And what progesterone does is it actually prepares the uterus for pregnancy, which is important because if you don't have enough progesterone to maintain your uterine lining, you'll end up bleeding a little bit sooner or your spot before your periods. And that can cause a lot of issues too. One of the things that my patients will experience around perimenopause is usually progesterone and DHEA, which we'll talk about that one, are the first hormones to drop. So a lot of women will start having really long periods where they'll bleed for about 2 to 3 weeks. Or they'll have a lot of clotting as well. So I see that often, and that's because of progesterone. Without the progesterone being at an adequate level, you can't maintain that uterine lining, and you'll just continuously bleed. So made in the corpus luteum, part of it's also made in the adrenal glands, men make it as well, and it's also made in the adrenal glands. So important for preparing the uterus. It also balances the effects of estrogen. It's always really good for mood and brain support. So a lot of my patients that go through perimenopause, they start to have a lot of sleep issues, and that tends to be the drop in progesterone because it's super important for that. And then usually what will happen is have a lot of mood changes around because progesterone. For men, it's actually used to make testosterone, so it's important, but it also affects mood and brain function. One of the supplement reps is kind of crazy. Tim, he is the one that is in the company that makes bioidenticals, but he was telling us that he puts it on his neck every night and he sleeps like crazy. I don't know if I'd be the first one to recommend that for my male patients, but I will say my female patients do really well with it too. So it's just super important to understand what these hormones do in your body so that you can make informed decisions about this and understand why your body's doing this. So progesterone is regulated by the pituitary gland. So testosterone, which is also important, of course, for men, but also women as well. For women, it's made primarily in the ovaries and the adrenal glands. For men, in the testes, and then DHEA is also needed to choose, which we'll talk about. DHEA is needed to be. So for women, it's important for libido, mood, growth strength, and muscle tone. So for my patients that are menstruating, usually you get a spike of testosterone around mid-cycle and ovulate. And that's when you should be having a natural fluctuation and increase in sex drive. If that's not happening, usually that tells me that there's something wrong. There also could be another end of the spectrum when you have too high testosterone, and that'll actually prevent you from bleeding. But a lot of my patients that are perimenopausal, what will happen is DHEA, which we'll talk about, is needed to make testosterone, and that's one of the first hormones that drops before menopause, along with progesterone. So that usually will cause a lot of metabolic changes, energy changes as well. A lot of my patients that are postmenopausal, usually they're given estrogen and progesterone for support, but I usually tell them to try some testosterone with this as well, because this is a very important hormone for bone strength, maintaining muscle mass, and sex drive too. For men, it's responsible for sperm production, muscle mass, libido, and it actually deepens your voice too. But from what I've been seeing a lot recently, and of course I see a biased population, which is kind of to for hormonal fluctuations, that a lot of young men are having pretty low testosterone. And testosterone replacement therapy is something that's really, really well just prescribed, which is frustrating because it's been really difficult for women to get support. Sorry, Bill. But it's easier for men to get the testosterone replacement than it is for women to get the hormone therapy. But it's really important to advocate for yourself and know that there are other options as well. And then testosterone is regulated by FSH. So there's a theme here. Most of our sex hormones are regulated by that FSH. And then we have DHEA, which I won't pronounce but essentially the DHEA is made in our adrenal glands. Small amounts are also made in the ovaries and testes, and this is what's needed that's used to make testosterone. So when you look at that diagram in front of you, you see DHEA down there. It's used to make estrogen and testosterone. It supports mood, energy, immune function, libido. This one's actually regulated by ACTH, which is that adrenocorticotropin hormone. And essentially what this does, ACTH also regulates cortisol. So for a lot of my patients that tend to have high cortisol levels and a lot of hormonal imbalances, what will happen is that sometimes because this hormone is a little bit higher, it'll cause their body to not only make high cortisol, but high DHEA, which can kind of further those hormonal imbalances. And it is created in response to stress, aging, circadian rhythm, but also, like I mentioned, it's one of the first hormones that drops down. And then we have our thyroid hormone. So there's a reason why your natural doctor wants to touch the thyroid all the time, because you see it regulates so many things: our metabolism, our heart rate, our body temperature, digestion, energy. One of the things for patients postpartum is what can happen is once you deliver baby, what can happen is your thyroid can become inflamed. And so sometimes a lot of women will end up having some thyroid issues, and that'll worsen their postpartum symptoms, which a lot of doctors usually don't test. So I always advocate for my patients to check on that too, because anytime we go through hormonal fluctuations in your body, your thyroid can become affected. So a lot of my patients with perimenopause, menopause, part of their life, I really will focus on looking at their thyroid, because that drop in hormones can really mess with things. So when I'll have patients that have had fine thyroid their entire life, and then they go through these hormonal fluctuations and it starts. So thyroid hormones are made in the thyroid gland. And whenever we test thyroid, we look at TSH, T3, and T4. So TSH is that thyroid stimulating hormone. The thyroid pituitary is what turns on thyroid to T3 and T4. So T4 is converted to the more active form T3, and that's what's used by cells. And that's what really regulates energy. Cortisol, the topic of conversation recently and kind of in medicine right now. So cortisol is made in the adrenal glands. The adrenal glands sit over our kidneys. They have two parts, the cortex and the medulla. So the cortex is the outer layer of the adrenal glands. Cortisol manages our stress response. I think the past couple of weeks I've been on my soapbox for patients, and cortisol is not the bad guy. The problem is that our bodies are responding to a stimulus and therefore increasing our cortisol. The stressful lives that we have, everything's kind of life or death for our brains. My patient said that recently, and I thought it was just perfect. Because instead of going from 0 to 50 when we respond to stressors, we're going from 0 to 50. And so cortisol is supposed to be high in the morning and dip throughout the day, so then our body can make melatonin and you can sleep. But a lot of us are like this all the time. Or we even have lower cortisol during the day and then have it at night, and that's causing. So cortisol is not the bad guy. Society and the way our bodies are structured and everything is like in death is the bad guy. We need cortisol. If we didn't, we wouldn't be able to regulate our blood sugar, our blood pressure, or run away from danger. And so, like I mentioned before, the cortisol is regulated by ACTH. I don't know, a lot of us tend to recommend the HPA Adapt supplement. I don't know if any of you are taking that one. HPA stands for the hypothalamus pituitary adrenal axis. And so if you've worked on your cortisol levels with any of us, you know we stress adaptogens. So adaptogens are herbs that help you adapt to stress. So I work on that hypothalamus pituitary adrenal kind of feedback. And they helped your body to regulate itself. So instead of going from 0 to 100, it goes from 0 to 80 or 0 to 50, which is goals. I tell my patients we're kind of medicating ourselves through in this program, which is unfortunate because I don't want that to be a thing, but sometimes it's just very hard to kind of get our body out of that type of fight. And because, as you see in that diagram, cortisol is in that pathway of all of our hormones, more often than not, I'm seeing because that's so high, it's causing a lot of hormone.
Next question.
Yes,
Is there anything besides stress that throws that cortisol clock out of whack?
yes, yep. Essentially, it can be a stress response. Sometimes even just little things like if you're having fluctuations in your blood pressure, blood sugar too, that'll cause kind of that fight or flight response as well. Any injury can do that too, surgery as well, a lot of different things. Like I said, and what I tell my patients too is we try to look at things linearly with these hormones, but as we know, all of the information that I'm giving you today, everything is kind of going on. So you mess with one, it's gonna mess with it. Which is why I like to go for more balance approach. But sometimes all it takes is balancing this cortisol level, but even just hormones to balance themselves as well. Yes. Yeah.
So if that's the case, do you recommend that that's just like a baseline thing to do adaptogens to kind of keep stuff regulated?
I usually will tell patients that,
Yeah.
you know, because when we check hormones, I usually do it through the blood. We're guesstimating kind of where you're at. We don't know if we're catching you right at your progesterone peak when we're supposed to, or when the estrogen's at its highest. More often than not, if I see cortisol really high, and I'm not seeing so many other issues with estrogen, progesterone, and testosterone, I'll just focus on those adaptogen herbs. And it makes a huge difference, especially for my patients with PCOS. If you're familiar with PCOS, that can cause a lot of hormonal imbalances. But the cortisol is usually where I focus because a lot of us are just kind of in that chronic state of fight or flight, and we don't even realize it too. And sometimes it's the cortisol throughout the day that's messing with our sleep at night. Yes.
So, in a postmenopausal woman,
Yes.
is it easier to capture hormone levels?
Actually, yes.
Yeah.
Yeah, it is because you're not having those cyclical fluctuations. So ideally, we would see that FSH and LH will stay high for the rest of your life because unless you're doing hormone replacement therapy, it's going to stay pretty high. Estrogen will fluctuate. So what happens is there's different types of estrogens that are given depending on where you're at in your life stage. Estradiol is the male estrogen that's made from the ovaries that regulates menstruation. So that's what drops. And then your body makes estrone, which is a different form of estrogen that's made through fat cells, and it's not as strong. So that's why the hormone replacement therapy is estradiol. Excuse me, because it's the more strongest form. But more often than not, if you're not on any kind of hormonal treatment, your FSH and your LH are going to be high, your estrogen is going to be low, your progesterone is going to be low. And then testosterone, I usually will kind of see on the lower end in that individual. Yes.
If you have a stressful period in your life, and that is the time, does your body repair itself?
It's supposed to. That's what our idea is with natural medicine. Is give the body what it needs, and it should be able to do this. I think that depending on how long that stress period was, your body should be able to be resilient. It just might take some time. I think a lot of us, one of my patients are telling me now is that the state of the world is really affecting them, whether they know that or not. And so we all have this underlying stress that is there, even if we're not kind of cognizant of it. And that's something I kind of keep in mind too. But the body does, it can regulate itself. It's just about even, as I tell my patients, my brother is sleeping after you check. So you don't have to take all of these things and you can kind of just live your life, which is ideal. I think we're kind of far past that, and sometimes you do have to take things, but there are so many other things that can help regulate the cortisol. Vagus nerve, we've heard that. That's one of the main nerves that is responsible for our parasympathetic nervous system, which is our rest and digest. We're going to talk about adrenaline. That's our sympathetic nervous system. So even doing those on a daily basis, just to support that rest and digest part of the nervous system, can be helpful as well. Yes.
So if you've been in fight or flight for years with a health issue, how do you fix that?
That's a good question.
Yeah.
Because what can happen is you can go into adrenal fatigue where your adrenals aren't even responding to these hormones anymore and you're not making cortisol. And so it's all about kind of, I always tell my patients baby steps. We know we want to be here, but sometimes we can't be here. And so just figuring out things that are going to teach your body that it's safe. And it doesn't have to go from 0 to 100. Whether that be self-care, vagus nerve exercises, which are anything from some of my patients, they're just so stressed that they can't even sit in silence and meditate. And so I usually will give them a well-rounded, whether it be kind of deep breathing or meditating or even doing things that are going to physically shock your body into that restlessness. You can shock yourself with cold water. That will stimulate that vagus nerve, which is why a lot of people are doing those plunges. And then also gargling, you can do that too. Even humming as well. And laughing. All those things that we do. And so that can help you. One of the funny things is my professor used to tell me that my adrenals would be shot after school and that it would take at least 5 years to finally be able to rebuild them. I will say I'm 4 years out and I just started taking an adaptogen because my body can handle it. So figuring out kind of where your body's at, not pushing it and just giving it the support it needs to build up to get to that point. Sometimes the body does not like it when you push it too far. And so figuring out where it's at. And we talked about the parasympathetic nervous system, which is our rest and digest. So the opposite of that is the sympathetic nervous system, which puts us into the fight or flight. So we talked about the adrenal glands. The outside part makes cortisol from that. The inner part is called our adrenal medulla. And this is where we make our adrenaline. And this triggers our fight or flight response. So cortisol does that, adrenaline does as well. This increases our heart rate, our breathing, blood pressure, and blood sugar. So we're running away from danger, essentially. A lot of my patients will ask me about this too. It's not something we usually test. When we talked about the different types of hormones, so cortisol is a steroid hormone, it's made from cholesterol, so it's easy to kind of test them with that. Adrenaline is one of those hormones that are made from amino acids and building blocks. But adrenaline doesn't stay in the body too long, so it's a really quick breakdown product. And so it's not the best thing. You can't really test that too well. There's a urine test that we can do for that too, but this adrenaline is kind of that quick. You're running away from the danger. Somebody's coming after you, you're running away from the bear, you need to go. So that's why your heart rate increases, your breathing, your blood pressure, and your blood sugar. And because it increases your blood sugar, because you need energy to run away from danger, when you come down from this, most of us feel completely exhausted because our body's just losing all of that. And this is actually not regulated by our pituitary like other hormones. This is regulated by our sympathetic nervous system, so that fight or flight. So this is more of kind of like an controllable thing. There's not a lot of steps that need to go through. We don't have that hypothalamus. We don't have that pituitary. It's the body just saying, okay, rapid, let's go. So with release their stress here. Another one of SpongeBob. And this is melatonin. So melatonin, we talk about this circadian rhythm a lot, which is actually pretty good. So cortisol and melatonin play a role in that. Cortisol later in the day starts to lower quickly before bedtime so that we can make melatonin. You'll see a lot about the blue light glasses, staying off electronics before bedtime. Because blue light actually will suppress the production of melatonin. So it'll stop our body from making it, which is why you see us patients stay away from their dark at bedtime. And darkness actually stimulates melatonin. So that's so important, having a good sleep hygiene routine, making sure that you're sleeping in a pretty cold room, because your body's temperature fluctuates in sleep, but also making sure that it's really dark. Whether that is using some blackout curtains or wearing an eye mask to cover the eyes, it's really important to do that. So it's not just kind of society stuff, going back to that and cortisol. Because if you're having these fluctuations throughout the day, it's going to be really hard for our body to know, okay, it's time to reduce our cortisol so that we can make that. So sometimes you can just treating patients in the beginning of the day to reduce their cortisol, and it can really help with their sleep as well. Just paying attention to saying away from the blue light. I get a lot of questions from patients about the red light too. Some of my patients have been swapping out their bulbs in their house for red light and using that at night. And that's just to prevent any of that light that red green potentially.
What would be the reason why some people like that?
That's a good question. It's usually the way that they're breaking it down in their body. Sometimes what can happen is people just can't break it down properly, so they'll stay in their system a little bit longer, and that'll cause them to be a little bit froggy.
For my son, it's an agitated.
Yeah. There's a lot of great research on melatonin and the brain and kind of the inflammation in there too. There's lots of genetic testing and things to kind of see how your body does. I usually don't recommend melatonin, just because it's usually, the goal of it is to help you fall asleep, not stay asleep. So if that's the problem and you can't fall asleep, because sometimes it's a little bit, but more often than not, I'm usually focusing on cortisol support. If cortisol spikes at night, that'll cause you to wake up. A lot of patients will feel hungry, or their brain will kind of be like, oh, okay, let's get ready and start our day. It's 2 in the morning. Or, oh, we forgot a treatment for a patient.
Well, that was one of my questions. Yes. Can cortisol, a spike in cortisol wake you up?
Yeah. Usually what I'll do is for most patients, I'll check their cortisol in the morning before 9 a.m. just to see where it starts out at. But there's a test that you can do with the saliva at 4 different points throughout the night, throughout your day. So it's usually morning when you wake up, mid-afternoon, maybe right around dinner time, and then around midnight, even like 2 or 3 a.m. And what I'll see a lot for patients with chronic sleep issues is their cortisol will spike around that time when they're supposed to be going to sleep or they're supposed to be sleeping. So that will happen often. And usually I tell patients just look out for you feel wide awake, your body's ready to go. Some patients will even wake up feeling anxious. That'll happen too. Or even feeling yes, totally.
So just for instance, if I take melatonin, it does the adverse effects. Is it because of cortisol?
It could be, it also could be the way your liver detoxes it. I have a few patients that will get the opposite effect where we'll give them a really calming herb and it'll actually make them so energetic. So that could be a possibility. So So insulin's been kind of a topic of conversation in medicine right now with the GLP-1, semaglutide, and everything. So insulin's made in our pancreas. What it does is it tells our cells to take our blood sugar and use it as energy. It also helps to store some of the excess blood sugar in the liver. It supports fat storage, protein production, and it also regulates our energy metabolism. What can happen though is cells can start to not respond to insulin, and even become insulin resistant, meaning that that same amount of insulin is just not getting that signal to your cells, and the blood sugar will stay. And that's usually the number one cause of diabetes. So what happens is there are hormones that are called incretins, and these are released by our digestive tract after eating, and these will signal insulin. So that's what GLP-1 does, which is the Ozempic semaglutide medication. They mimic this hormone. So the idea is that if you're keeping that, it's going to increase your insulin levels and help you regulate your blood sugar. But as we know, based on everything we talked about with our hormones, is that when you mess with one hormone, you're going to mess with a few other hormones, which is why there's a lot of different side effects and things that are coming up. I would say a lot of my patients with PCOS, which tends to cause more irregular periods, when they take the Ozempic, they start to have cycles, which is great, but also concerning. Because you think about, okay, what is that doing in that entire hormone pathway? About when you take these types of medications either. Because, you know, with medications, different than herbs don't follow textbooks. They do what they're supposed to in the body. They might give you them for one thing, but they might decide that they want to help with other things. With medications, they're targeted to stimulate a certain part of the body. But that GLP-1 has other things that do that. Insulin doesn't just regulate blood sugar. As you see, it does a lot of other things. So something to keep in mind. That rest and digest part of our nervous system, the parasympathetic nervous system, helps with insulin. So this kind of feeds the cortisol, fight or flight mentality too, where I'll have patients that eat well, exercise, they're doing everything right, and then their blood sugar or their A1C is high. And what happens in that, it's because their cortisol levels are high. Cortisol increases blood sugar, but also prevents our body from making that insulin and getting into that insulin response. Sometimes just doing that can be helpful. And then insulin can also be stopped for one. So that's something, you know, if you can get kind of one takeaway from this, it's the big picture of these hormones are really important. And when we're in this chronic state of fight, and not just looking at one hormone, but thinking about the entire. Yeah. Anything like that you're doing?
Just
In terms of like, Yep. Okay, yes, yes, you're frozen, so you're not doing anything.
Yes.
You're not in that rest and digest, but you're also not, yeah. And that too, it's our nervous system, like we're learning so much, like that brain access. So the brain, like we see, is affecting so many things. And so when you're in the frozen state too, it's almost like your body can't react to anything, which is also bad. therapy because we need that fight or flight. We want you to have those responses when you need it. So it becomes kind of like this balance too. I think, you know, at the end of the day, it's all about when I see a patient that has any kind of trauma, mental health cancer, sometimes just focusing on support for the nervous system. It's like, okay, what I see a lot from my fertility patients is they're so stressed about getting pregnant that their body does not make its hormones properly, which is counterintuitive. But I always tell patients kind of think about if you're running away from danger, like your body's not going to stop and procreate. It's not going to stop and make its hormones. And so even just focusing on that and helping the body become safe. Yeah, definitely, because you're not getting that response anymore. That's usually what we see with adrenal fatigue is when you're constantly stressed all the time. Sometimes your body's just not moving anymore. And that's going to mess with that entire pathway too. And sometimes what will happen is your body will shunt those hormones to something, which is why cholesterol is a stimulus to something. It's there, you know, your body's making it for some reason. What will happen is a lot of my patients in perimenopause and post-menopause is they'll start having high cholesterol levels, and they have never seen that before. They have normal cholesterol levels, and then all of a sudden they have high LDL, which is a quote unquote bad cholesterol. And that's because estrogen drops, and estrogen is protected for the repair. So what will happen is that LDL will spike up.
So I just have a little insight that I got from this talk.
Yeah.
My daughter has suffered from eating disorder for years, and the biggest change in her recovery has been that living in the South and walking on the beach in the mornings every day barefoot. Grounding, lowering the cortisol has just enabled, I think, it's just like a hidden thread. Oh my gosh, that's what's been happening.
Yeah, definitely. And when I have patients that move out of New England, they tell me they're like, it's different.
It's
I
so
feel
different.
different. I feel so much better. I have one patient, her digestive symptoms will not budge. They're not, and her work is so stressful. Every time she goes on vacation, nothing. She has no issues. She can eat whatever she wants. She does all these things, and you know, at some point, she's gonna retire soon, so I'm keeping my fingers crossed. But it's just, you know, the further we get from nature and sunlight and being outside and grounding and doing all those basic things that our body needs, the worse things get. And that's why I really have to focus on supporting the body and doing those things. Do I think we can all be in the woods and just frolic in the flowers? No. But having that time to be out in nature and doing things that much better because we're constantly kind of over that, especially like family and everything's like hustle mentality. We have to keep going and not stopping.
So I wanted to do that on that. It's
Yeah.
just a funny story. So I'm from here, but I did move when I first got out of college to Georgia. And for me, it was very stressful to adapt to that lifestyle. I will never forget, I went to the grocery store and the lady that was checking me out was like, just like, yeah. And it was causing me so much anxiety. And there we go. And I was like, okay, why are you doing the good wrong? It's not that bad. And I'm like, oh my gosh, so like people behind are gonna be like, why is she taking so long? And then I was really anxious. And then slowly, like back since I lived there, it almost was like it gave me the okay. Like I was like, even my own body, I was like, hey, it's okay to be like that because no one around me is expecting me to be that way down there.
Yeah.
But then when I come up here, it's just like exactly that. It just changed everything.
Being able to see what it's like someplace else and your body's almost like, well, this isn't what I'm used to. I always tell my patients if you can't sit in silence and it stresses you out, that means you you need to do it more, because that's your body telling you, you're not used to this, you can't handle silence. No. I'm from Mass originally, South Shore, so close to the Boston, so you know what that means. But we will literally rather die than let somebody cut in front of us. So I moved to Providence in January, and I thought to myself, why am I doing this? Why am I putting my life at risk getting this terrible road rage for what? Let them go. Probably makes their day. Especially in Dana when nobody can get through now. You know, why are we like this? Why are we doing that? And just stepping back and thinking, there's no reason.
I love when people don't let you go over and then you end up at the same red light.
Yeah.
And then you're like, okay.
Exactly. I think it's like that your light is showing up in different ways. Road rage and just as you said,
Well,
distance.
Will we ever? I think it will be a different world.
Yeah.
If we can get rid of our bottom line down.
Yeah.
I'm
Sure,
spray
I love
paint.
that.
It's the color of the barrel.
Yeah, definitely. But you think about all the little things that kind of set you off throughout the day and put you in that place, right? And just stepping back and thinking about that. Does this need the response it's getting? Is there anything that I can do to kind of heal that back? And you notice the difference. It really does make a difference. You're just figuring out what's best for you. Sometimes you can't sit in silence and meditate and deep breathe. Maybe you need to splash yourself with cold water. Just get that physical feeling. Even it's kind of some of the things that pages with panic attacks you usually do today. Lay on the cool floor, any kind of changing temperature. One of the things we learned in math practice school is, of course, we learned, our medical things and all of those things, but we also learned some crazy and wild things too, which is walking barefoot in the snow in the middle of winter, just to help get that freezing cold to stimulate our immune system. Because if you do that, then hopefully we won't get any snow anytime soon, but you never know. Any other questions for me?
Don't plan on moving out.
I'm not going anywhere yet.
Yeah, kids, like what I've seen now that my kids are adults, that just progressively, these kids can't get outside anymore.
Yeah.
They don't have recess.
Mhm. Yeah, and I think about how grateful I was to be a 90s kid where we had our Nintendo and things like that, but we played outside. And we were always doing something and we'd come back home when it started to get dark. It's like that when do that. My niece just like and she doesn't even have to go see her friends. She has her phone, which she can video chat, and they can play games on the Xbox and they can talk to each other. And they're missing that huge piece.
Do you think that can affect and just to add on to like the kids and stuff, like and puberty and hormones and all of that, like how do you think just like the state of the world and just to tie everything all together, like cortisol and all of that, how is that affecting like the adolescents, like and just how they're growing and how they're can that just kind of change like the trajectory of how they're growing? Like how do you kind of what's a red flag,
Yeah, great question. I can see a lot of kids, 6 to 8-year-olds with insulin resistance, which is pretty crazy, and they're exercising like really low and their body's just not regulating their hormones properly, which we didn't touch upon this. I think it's going to be a whole other lecture, endocrine disrupting chemicals. So things like BPA, which is a good tie into this. We learned about the pituitary and the hypothalamus. BPA is found fast that actually blocks the pituitary and can actually hang out in the brain and block cells in our body from using our hormones properly. So that is one of my main things that I stress upon patients, plastics, cleaning products, personal care products. There's even some in water right now. So nothing goes clothing, everything. So what you put in your body and on your body on a daily basis, do your best, but the livers need to do the rest. At some point though, those endocrine disrupting chemicals are causing issues, which is probably why um, girls are getting their period from 9 to 10, and endometriosis is popping up. There's so much infertility, especially for females and boys. You do, you can always reach out to us. We have our contact info. Shoot me an email. I'm happy to answer any questions too. And then if you have any ideas for any lectures or anything, I'd love to do this as well. At one point, I did kind of like an intro cooking class at one point because I used to be a chef, and that was a pretty big hit.
Yeah.
So I'm definitely open to doing another one too. But I think as an naturopathic doctor, one of our principles is doctor as teacher, and that's something that I really focus on. Because we know about the bodies and make informed decisions and also understand why we're testing these hormones.